Well, hi, everybody. Welcome to today's edition of the podcast. I'm Marcy Marcusa, and today we're going to dig into healthcare and our system from a number of perspectives. So the first one is, do you know where to go? We know on January 7th that a man died in the ER waiting room at Health Sciences Center. We know he waited 8 hours. We know at the time there were 100 people at one point that morning in the ER. The question is, did all of the people who were there need to be there? Could they have gone other places? That's where we start. This is Manitoba. So the answer to that question is, yes, there are. And in fact, there are some new things in the system, new spaces in the system, rather, that might actually be helpful when it comes to an emergency or a challenge with your health. So how do you navigate the system? What is the difference between a minor injury clinic and an urgent care center and the ER? Let's begin there. Wait times in the city have led us to exploring this, and that is because they are high. When compared to national averages, the national average is 5.2 hours of waiting. All three of the city's emergency departments here in Winnipeg had longer wait times for most patients. Now, that's according to data from the Canadian Institute for Health Information. And as of November, with other data, the Winnipeg Regional Health Authority's latest monthly report in November said Health Sciences Center wait times specifically were at 13.16 hours. So how do you avoid the wait in the ER, and when should you make that choice? To learn more about the choices in our healthcare system and where you could go, we have reached Dr. Amanda Condon, who is with Shared Health. So I know that it's interesting, having done this show for a long time in the community. We do this interview time to time because people sort of, whether you forget or whether it's because in the moment of need, that emergency for you, you might just go straight to an ER, but maybe that's not where, there might be a better option for you. Can we start with just running down the options that Manitobans have if they're seeking care?
Absolutely. And we actually, especially in Winnipeg, have a number of new options over the last year. So certainly, any time that you're facing any sort of minor injury or illness, your best course of action is to try and reach out to your primary care provider and see if you're able to get an appointment with them. Recognizing that is challenging currently for lots of people in terms of accessing their primary care providers, and lots of people don't have access. Walk-in clinics, which we've had in Winnipeg and Manitoba for a long time, are another good point of access to be able to reach out to someone and see if they can get an appointment. Oftentimes, walk-in clinics are only available sort of daytimes, maybe mornings on the weekends, but not always a lot of access evenings and weekend hours. And so in Winnipeg now, we have 2 extended hours primary care clinics that are available, one on the Grace campus and one on the Concordia Hospital campus. And these clinics provide same-day primary care access evenings and weekends. You also can access care through minor injury and illness clinics, a new one opening up at Misericordia. These clinics are available during the day and also on weekends. There's a lot of overlap between what sorts of services that you can access through these clinics, but mostly this is that sort of same-day need for things that you need care for.
There's a lot of information that was just shared there. So where can you actually walk in, and where do you need an appointment? Because I know at some of the minor injury spots, for example, things were shifted. I know years ago there used to be one on Condon that supplement the system. It was great, but now you do need an appointment there. So is there a way to distinguish where you need appointments and what is actually walk-in now?
Yeah, so the myritecare.ca website is a great place to go to get that information. And the great thing about that website is it lists all of the walk-in clinics and all of the various places that you can access care. And for many of these clinics that do book online appointments, so you can book, that way you don't have to wait. You go when the time is set for you. You can book all of that online and see some of the options that are available for you. The extended hours primary care clinics, so those are those evening and weekend clinics at Concordia Hospital and at Grace Hospital, are primarily same-day bookable online, but they also do take walk-ins. So there are appointments reserved every day to accommodate people who walk in. The minor injury and illness clinics are primarily same-day bookable, so same thing, you can go online and book an appointment for a time for you. Walk-in clinics across Winnipeg are variable in terms terms of who takes walk-in. We know the experience with walk-in clinics now is oftentimes they're full. That My Right Care website is a great place to go as well, because then you can get a kind of a one-stop to see what's available and then have contact information to call ahead and see what's available.
So you're talking I'm just going to say this because you mentioned it a couple times, myrightcare.ca. Or is it .com? Yeah. Okay, .ca.
It's .ca.
Yeah. I interjected. Sorry, you were going on to say something.
That's okay. Oh, just to say that HealthLinks is also another option for people. So if you're not sure where the best place to go, connecting with HealthLinks can be a good option as well. And they can sometimes help to direct people to appropriate resources through the extended hours primary care clinics are new, but certainly in the times that I've worked there have had people who've said, HealthLinks suggested that I come in. Then they were able to navigate to the website, book an appointment online, and we were able to see them the same day.
When you're in a moment of crisis in your own family, of course, or especially if you have a child, I would argue, right? Like, I shouldn't say especially, but it can be very stressful if you have a child, you don't know what's going on with them. People might just still say, I'm still going to emerge. What's this, if you feel it's an emergency, but you're not quite sure, what would be the second thing that you would go to? If you don't go to emergency, what's your first choice after that? Pardon me, is how I should phrase that.
Yeah, great question, and a little bit hard to answer, right? Because there is some nuance there. I would think that the place where you can be seen is going to probably be the next best place. So the place that you know that you can get an appointment and that you can see someone. The good thing about accessing care through any of these options, and we've purposefully designed things to make it easy for people to access care, as easy as we can, given the constraints that we currently have, that if you end up in a place where if you end up in an extended hours primary care clinic, for example, and you really need to be seen in an emergency department, the staff and the provider and the team working in that clinic will work with you to make sure that transition over to the right place is as seamless and easy as possible.
Can I just ask you, just because you brought that up, sort of the new options, right, that are on site at the Grace, and then the Ms, as you mentioned, and Concordia. So those will be the three. If that in the future, as you said, if you do need emergent care and you're there, they could put you to the emergency room. Are we at the stage in our system yet where it goes the other way, where the emergency rooms can refer to those clinics? Like, is that the purpose of having them on site?
That's one of the goals that we're hoping to get to. And we want that to happen in a safe and patient-centered and seamless way. So we want people to feel that they're accessing care where they need it. But if someone presents, for example, to an emergency department and they're triaged by the staff there as a lower acuity patient, that they may be presented with options around seeking care somewhere else and then working to transfer the care over to one of the other clinics that's available.
I can hear listeners I always say I can hear listeners in my head talking to the radio. And the one thing that in our conversation that isn't there is a 24-hour option, right? I wonder whether or not more people are going to ERs for anything and everything, because overnight that's what's open. What in the system should they understand, could be an option for them in the middle of the wee hours of the morning, so to speak?
Yeah. Certainly, I think the overnight care is challenging, and you're right, there aren't a lot of any other options outside of emergency departments. What I would say is that if you feel like you need care overnight that can't wait till the morning, an emergency department may actually be the ideal place for you to seek care. And as we're rolling these new clinics out, we've talked about a number of models, in the last 5 minutes, all of which are new. Measurement and evaluation is a really important part of what we're doing here to try and get a sense of who's accessing care with what types of medical issues, what's bringing them, what time of day are they coming, to get a sense of what that need and demand is. Certainly what we've seen so far with these new extended hours primary care clinics is that people are accessing care in the evenings and even until 11 o'clock at night. So I think we are providing a service that's meeting people's needs. I
want to throw two quick scenarios at you. So with a child that is ill, do you go to the Children's Hospital emergency room specifically, or do you go to your closest hospital ER? Obviously, it's dependent on how urgent things are, but I wonder whether or not you should be thinking specifically about the kids' hospital.
Yeah, great question. I mean, again, I think your point is exactly correct. It depends on how urgent. If you have a little kid with you that's very, very sick, you want to take them to the closest place. And they, again, will be able to direct care. Generally speaking, for children, Children's Hospital is a good place to bring them and is quite reasonable. But for those kiddos that are, you want them to be assessed. You're not too worried. They're not, you're just not sure. You need them to be seen. The extended hours primary care clinics are great places to bring them.
I twisted my ankle. I'm not sure if it's fractured or not. Am I going to ER or should I wait it out if I can and book it minor injury?
Definitely. I think trying to book for one of those clinics, minor injury clinics, even extended hours primary care sometimes can be a good option. We do have access to x-rays and blood work through those clinics and through minor injury as well. So oftentimes that scenario is the perfect example. I twisted my ankle. I'm not sure. I feel like it needs an x-ray. The minor injury and illness clinics and the extended hours primary care clinics can be good options.
And just Dr. Condon, as a last question here, if someone decides that they ultimately do have to go to emergency, it's the right place for them. Do you have any advice for how they might be able to make their stay as short as possible?
I think if you do have any chronic conditions, making sure that you bring your medications with you, or certainly a list of your medications, being really upfront when you check in about who your primary care provider is, so that you can help to make sure that information flow goes. And if possible, if you have a family member or someone who knows that you're going, depending on the circumstance, can be helpful with that information sharing piece and things like that.
So that's my conversation with Dr. Amanda Condon, who's the medical specialty lead, by the way, of family medicine with Shared Health. Well, we do have comprehensive coverage about our healthcare system, about wait times, also about how we can do better in various aspects. And one of the things that we've been talking about in the podcast has been the fact that some people that are in the ERs are there because they are seeking shelter. This is something that's happening across the country. So today we're going to take you to Toronto to explore a recent study that was done. And Stephen Hwang was part of conducting it. He's a physician in general internal medicine and a research scientist at the MAP Centre for Urban Health Solutions at St. Michael's Hospital in Toronto. So the study that I'm referring to looked into why people use emergency rooms to seek temporary shelter. Here's what he had to say.
Well, a few years ago, our colleagues in the emergency department told us that they were seeing a surge in people experiencing homelessness coming to our emergency department simply to seek shelter from the cold. And so we thought actually that it would be important to document this with a research study. So we looked at emergency department use data from across the province of Ontario and looked specifically at use of emergency departments in the winter months by people experiencing homelessness. And what we saw was that there was a dramatic surge, a 70% increase in non-urgent emergency department visits by homeless individuals. And we see this as a clear indicator that a large number of people are coming to our emergency departments simply to seek shelter in times when there's not enough shelter beds or warming centers.
A 70% surge in people seeking shelter. What did that mean? Your study may not have gone this deep, but what did that mean for the actual environment in the ERs and for the impact on medical professionals?
Well, I think from the patient perspective, it meant incredibly crowded emergency department waiting rooms, which we know are crowded at the best of times, but it meant that they were even more crowded. Some of the people seeking warmth would not actually register seeking care. They would simply come and sit in the waiting room. But for those who felt that they needed to provide a reason to be there, they would register with the nurse and be triaged. And this obviously would have the effect of increasing the demand on the doctors and nurses in the emergency department. So we really see our emergency departments becoming a functionally warming centers in the wintertime.
How did you go about getting the results? And was this a study that was done, how recently was it done?
So this study was actually done 2 winters ago, because that's when we first noticed this dramatic increase in the use of emergency departments in Toronto. Our data actually shows, and anecdotal reports indicate that this is really happening in large and medium-sized cities across Canada now. And we're intending to repeat the study to see if things have gotten worse over the last 2 years.
Did the study lead to any changes, in how intake is done in the emergency departments in Toronto? Because you said you're going to go back and see, whether things have improved.
Yeah, there's really not much that the emergency department needs to do differently. What we have advocated for is that there needs to be more warming centers. And the City of Toronto has changed its warming center policy to increase the availability of warming centers. They open up at less extreme cold temperatures, certainly not as extreme as they are currently in Manitoba. But I think the important take-home point is that we need to have warming center spaces throughout the cold season so that we don't have people seeking refuge in our emergency departments.
What were some of the reasons that people gave to stay in the emergency department? I know here we've heard, at least from houseless advocates, the reasons why Manitobans and effectively Winnipeggers would choose to go to an ER instead of a shelter. What did you hear in your study?
Well, I think we didn't look at this in our study, but my colleagues in the emergency department tell me that sometimes people will feel obliged to give some reason just to allow them to stay longer and get warm. And so they might say that they have a cough, or that their feet are numb or painful, or that they're just feeling fatigued and unwell. So often the person will have a legitimate, very mild complaint that they're giving as a reason just to simply allow them to stay longer in the emergency department and warm up.
I'm not sure whether or not this has been, you mentioned that you looked at this 2 years ago and you're planning to go back and see how things are looking now in Ontario. Is the population in Toronto of houseless people ever increasing, and that has led to what some of the challenges with having more people out on the street? Or is this an effect of post-COVID, having more people without shelter? I'm just trying to get a sense of the trajectory of how things have progressed in your province.
Well, unfortunately, there's pretty clear evidence that the number of people experiencing homelessness has increased significantly in the last 2 years. In the city of Toronto, the numbers have increased by about 20% at least. And a recent report suggests that there are more than 80,000 people homeless in Ontario right now.
How should, on the ER side of things, as people continue to come into those, to the ER that maybe don't have medical needs, as you said, but they want shelter and need shelter, how does staff, address and deal with some of those concerns? What has been happening in the ERs there?
Well, I mean, our staff try to be very sensitive. They're very aware of the reasons that people are coming in, and so they will understand if someone basically gives the reason that they really have just basic survival needs. They may say they need warmth, they need a warm jacket, they may need just some food and a chance to warm up. So our emergency department has a program that specifically meets those non-medical needs of people experiencing homelessness. I think that it's simply understanding that people are not doing this, out of for convenience or because they had any other choice. They're really doing it as a desperate last measure.
Well, given that we're talking obviously cross-province here, and yesterday we were actually talking to Nova Scotia. So, I mean, across the country, there's different research going on, try to figure out what's going on here and how to do better. And obviously shelters comes up as one of the big solutions. But what do you hope that the hospital administrators do with their results of your study?
Well, I think that what our hospital has done, and what I think every hospital that is seeing this should do, is think about ways that are not necessarily medical interventions, services that they can either provide or link people to that would help people, get what they need rather than staying unnecessarily long periods of time in the emergency department waiting room. That would be better for them and the healthcare system.
Is there anything that I have neglected to ask you that you wanted to say this morning?
Well, simply, it's just the obvious fact that we really want people to simply have a place to be warm and survive the cold. And if we don't provide those spaces, our emergency departments will fill up with people seeking warmth.
That was Stephen Hwang, a physician in general internal medicine and a research scientist at MAP Centre for Urban Health Solutions at St. Michael's Hospital in Toronto. My name is Marcy Marcusa. You are listening to This is Manitoba, the podcast that gets you through the news, what everyone's talking about in our province, and helps you navigate some of those stories. Well, right now, I hate to say it, but a lot of what people are talking about is the weather. And some of you might be thinking, the weather, we're always talking about the weather. But there's a reason to be talking about it. In December in Manitoba, and now again, as we sit here in mid-January, we're having wild swings in temperature, like 25-degree swings, where one day you'll be at minus 24, and the next day the daytime high is expected to be 1 degree. Alex Crawford is here to explain why this is happening. He's an assistant professor at the University of Manitoba's Department of Environment and Geography.
This is all connected to something we call the polar jet stream. And a lot of people have probably heard of that. But for those who don't know, if you look high up in the atmosphere, about 10 kilometers up, you'll find that there's this kind of river stream of really fast wind. It can get up over 200 kilometers per hour. And that is basically the boundary between the really cold, frigid Arctic air that's north of us and the warmer, more mid-latitude air that's sitting to our south. So whenever that polar jet stream has a big ridge in it, and that ridge comes over Winnipeg, we're going to get warmer than normal in winter. And wherever it gets a big trough, wherever it dips down to the south and gets below us, gets south of us, that's when we're going to be experiencing those really colder temperatures. And so what's been happening right now and back in December is that there's these big ridges and troughs, these big waves in that polar jet stream, and they're leading to these pretty quick switches between colder and warmer.
Did they not used to happen? I'm not recalling in the same way. Like we would have periods of cold and then you rarely would get a warm day. I mean, when I was growing up here in Manitoba, it would be like we'd always be looking at Calgary and the Chinooks and wishing we had that here. And now here we are above zero. Or what is happening, with climate science for what we're seeing more frequently here?
Yeah, I think first of all, this is probably more normal than people appreciate. That winter does typically have these swings with the polar jet stream where it gets colder and then it gets warmer again. And I think the thing that might feel a little bit different right now is that just with a little bit of a nudge of global warming, those really warm days, those warmest days are warmer than they used to be. And just for one little comparison, if you go from like 1950 to 1999, those last 50 years of the 20th century, January in Winnipeg would hit that 0 degrees Celsius mark maybe 1 or 2 days on average per year. That means some years it never happened. Some years it might be 3 or 4 days. Nowadays, so since 2000, it's been twice as common as that. And so that means that you're a little bit more likely to see us get up to that melting point. I think that really sticks in our minds. So the polar jet stream's still around. It's still doing its thing. It's just that when it crests that warmest part, it's just getting up to that freezing point a little bit more commonly.
A nudge of climate change.
A little nudge.
So it's interesting because a lot of people point to the swings and say this is absolutely climate change. And in past years, I've been cautioned to use that language on air. And you're saying, in 2025 here, this is, in your view, a nudge of it.
Yeah, I'd say that there's an aspect to it. And again, these big temperature swings are actually pretty normal for Winnipeg in winter. It's just that rather than going from negative 27, which I think was the lowest it got in this spell, up to 1, you may have expected to go from negative 30 up to like negative 3. And that's not that big of a difference. But when you're crossing that boundary of whether something's at the freezing point or not, we really do notice. To get back to the person talking about the slush and the snow, you're going to start to feel that once you get up to around 0. And if you stay well below it, you're going to keep that snow a lot more easy to wheel around in.
Are we seeing this, Alex, in the rest of the country as well?
Yeah, so the polar jet stream is a pretty big feature. So when I say you get a big ridge or a big trough, right now the ridge that's coming at us was over like Alaska and British Columbia and the Yukon all together. That's a big feature. Then when that trough comes over, it's not just going to be Winnipeg that's feeling it. It's going to be Saskatchewan, Manitoba, Western Ontario, all of us, to varying degrees how strongly, but that whole large area, thousands of kilometers.
What does the rest of our winter look like?
That's a great question. And unfortunately, even the best modeling that you can see done at ECCC or Environment Climate Change Canada cannot give a very good forecast for Winnipeg this year. The really short answer is that Winnipeg is always affected by what's happening in the Pacific Ocean. And if you looked at the Pacific, you'd say we should be a little bit colder than normal this year. But if you look at the Atlantic Ocean, which also impacts Winnipeg, you'd say we should be a bit warmer than normal this year. And precipitation, that's no knowing what'll be there. So that means this year is a very hard year to predict for Winnipeg. And so the best thing I can say is you can expect to be cold plenty of the time.
This is Manitoba. And from our cold, sometimes warm, then cold again province, thank you for listening. And don't forget to like and share.